Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Parul Dua Makkar and Liz Durnan. Thanks for joining us today, Parul and Liz.
Yes, it's my pleasure. Thank you for having us.
Oh, good.
Likewise.
You're very welcome. Okay. And I'm very happy to have you both on. And by way of a brief introduction, Parul is a general dentist focused on education and bringing awareness to oral cancer with the book Life Interrupted, Dr. Dua's Survival Guide. And Liz is a healthcare disruptor for positive change and chief growth officer for the Peace Advocacy Group.
Yeah.
And today we'll be talking about how the work each of you do supports doctors and patients. And the way we each do it is different. The mission is the same, though, to make healthcare better for all of us. So I'm looking forward to this conversation. And I usually start by asking what you'd most like our audience to know about you. And I was wondering if Parul, would you like to go first?
Oh my God. Oh boy, that's a loaded question. What would you most like to know about me is I have been I guess, a modern day nomad. I've lived in different countries, and that gives me a very unique perspective because not only have I met people from different walks of life, I've lived in different lives in different places. And so it makes me a little bit more understanding and empathetic to what I do and how I practice, especially after what I've gone through.
Okay, well, thank you for sharing that. And Liz, what would you like us to know about you?
I would say that by way of being a patient, I'm a very fierce patient advocate. And I would say that I am the poster child of Murphy's Law when it comes to being a patient, that what can go wrong will go wrong. And I think that's what's really led me to be so passionate about the work that I do with Claudia Cometa for Peace Advocacy Group.
Okay, well, thank you both. And not everyone has had the privilege or honor to hear your stories. Parul, would you like to share a bit about your journey?
Sure. So, like mentioned, I'm a general dentist and I was happy doing my little dentistry. And unfortunately, right around just before COVID, my younger and only sibling was talking about a lesion that turned out to be a late diagnosis for squamous cell carcinoma originating from the tongue. And in the midst of COVID, I lost him. So he was almost 8 years younger than me. So I watched him come into the world and leave the world. And because he was a dentist like myself and how he himself was missed and was late diagnosis, because nobody would think a 30-year-old healthy patient would have cancer of all things, and how quickly and rapidly it spread and took his life. So it forced me to come out of my shell in the sense of being more vocal and advocating for we need to be more self-advocate. You know, if you see something wrong, push for a diagnosis, get the biopsies, ask for second opinions, and also for doctors and dentists and healthcare professionals to realize what we're looking for and why it's so important and going beyond just the tooth. And also I created what's called a Do a Good Job Symposium, which is it's an online CE for all healthcare professionals, which helps bridge the gap from, oh, you got cancer diagnosis. Okay, off you go to the surgeon. Well, what do you do for post-op care? Patients can't open their mouth. They can't take care of their teeth. They need fluoride trays or radiation trays. Like there's so much nutrition, there's psychological impacts, estate planning. There's so much more to cancer than just a diagnosis and referrals. So I created this to help kind of bridge that medical and dental gap.
Well, thank you so much. And I'm so sorry that that happened. That is such a tragedy. And I was wondering if you wanted to share maybe his specific symptoms, if you felt that might help other people, like things that might have been overlooked.
Sure. So cancer doesn't have to be painful. It can be anything that's painful or not. And it's any lesion in your mouth that hasn't healed within 2 weeks. So if you got maybe a herpetic, a canker sore, you cut your tongue while, you know, I don't know, on a slice of, or burnt your palate with a pizza, cut it with something, it should heal within 2 weeks. Saltwater rinse, but if it doesn't and it's persistent, you need to get it seen and checked out. If you have trouble moving your tongue on one side, like you stick your tongue out and it deviates, you have an earache on one side, you feel a node, like we do breast exam and we're looking for nodes. If you feel a node in your neck, in your clavicular area, basically anywhere here, and it's on one side and not both sides, those are things you kind of have to be more vigilant and say, hey, I noticed this. Do you think I need to get checked out? Do we need an ENT referral? Get a scope done. So it's the cases that are diagnosed, one at stage 1 and 2, the survival rate's like 80%, and 70% of the cases are actually diagnosed at stage 3 and 4, and the survival rate's only 50. So even with all the advances that we have, it's the earlier diagnosis that's really the key to survival. And there's no like test per se, things are still getting FDA approvals for salivary tests. Unless we see something, that's only when we push and get a diagnosis. And the one other key thing I'd like to highlight is that before you get any treatment, make sure you know what you're getting treated for. So any lesion, get a biopsy to determine what it is so the appropriate care is done. In my brother's case, like he had a lesion, it wasn't healing, and his oral surgeon put him on prednisone, which is an immunosuppressant, and the cancer like grew exponentially within a month of that. And so he was given medication and immunosuppressant, not knowing what the lesion is, thinking it was lichen planus, which is an autoimmune. So the whole point is get a biopsy, push for an earlier diagnosis, and get an earlier treatment.
Well, thank you very much. Just sharing that can save a life. And what I'll add, because I've had cancer 3 times since the pandemic myself, 3 separate primary cancers. And what I would add is have regular checkups. And if a doctor recommends a scan, get the scan. Because in my case, I had no symptoms and I was shocked every single time to find out that I had cancer. But it was the diligence of my physicians ordering scans and tests, and then that I had 3 separate surgeries and courses of radiation and medications and such like that. So thank you. So
Dr.
Liz,
Pearl, Kim, do you mind if I ask her a quick question?
go
Sure.
ahead.
Dr. Pearl, would you say that the way for early of detection is just going for your routine cleanings, and that's how to do
Yes.
that?
Routine checkups every 6 months, or if you need more, depending on, and for dentists and hygienists who, who's doing the treatment, is when we're doing our oral exam, right, your checkup exam, your routine exam, and that's kind of when we're having you palpate and look, it takes really 2 minutes to kind of take a peek inside, palate, tongue, lift up the tongue. And you shouldn't have to wait for every 6 months. When the patient comes in, you numb the patient up and ask your patient questions like, hey, anything different from the last time I saw you? We're going to do this today. Did you notice anything? I'll take a quick look. It shouldn't be every 6 months. Whenever the patient comes in, kind of take a look, see if everything's good while you're administrating any sort of treatment. But yes, every 6 months if you have healthy teeth and gums. Yeah.
Okay.
That's
Thank
very
you.
important. So Liz, you've also had a dramatic experience yourself, if you'd like to share.
I did. So I was misdiagnosed with depression at 19. I'm 37 now, but I was kind of forced to go see somebody, and the therapist said, I'd even shared that with the therapist that, I was depressed, but I'm on the upswing, so I'm fine, like no big deal. I just need to do this to kind of just check off the list that I've seen you. She's like, that sounds great, but here, let's just go ahead and give you this medication as a boost to try to make sure that you're in the clear. So she had given me a sample pack of Lexapro. And your audience most likely knows that a therapist is not licensed to give medications. And the way her loophole was that she was stockpiling medication sample packs. I'm guessing when she would go to conferences or she'd run into drug reps. The specifics of it, I don't know. Long story short, I ended up in a manic episode. Never showed any signs of it beforehand, but I was just, again, checking all the boxes for, this is bipolar. I was hospitalized for 2 months. They went through the whole array of options and none of the medications are working. So that should have been the first red flag that maybe this isn't really what we're dealing with. Maybe it's just a drug interaction. And Lexapro at the time, it wasn't known as an adverse side effect for a manic episode. So they went through it all. I was basically a guinea pig. My family, it got very difficult because we had never dealt with anything like this before. None of us had ever seen anything like it. But my dad was the only one that every single day, whenever he could get there, he would be there and he would be with me. Even when I wasn't like mentally there, I don't remember much of it. I barely even remember a whole day. Like I would remember moments, and that's only a handfuls within that 2-month period. So finally they decided, you know what, nothing's working. They sat my parents down and said, we're going to try electric shock therapy. There's a whole set of reactions to that as well. She could lose some of her memory, her personality could change. And they said, but we have one other option. And that's this anti-seizure medication. They don't really use it anymore. It's very archaic. It's carbitrol. So they tried it and it thankfully worked. So then leading up after that, probably for 6 months, it took me to actually get back to myself. And again, it was my dad. My dad was the one, he would tell me after like a month or two, oh, Elizabeth, gosh, you look so great. And I would be like, okay, dad, like whatever. I don't know what that means, but I'm just going to go do my thing. You know, I'm 19 at the time. So I don't listen to my dad, right? So then another month would go by, you know, I keep hearing this like, oh, gosh, you look, and he would get so excited. Like I could remember the excitement on his face. And it was towards that like 6-month period where I was finally out of it. And I'm a pretty smart aleck person as it is. So when he said this to me again, he's like, Elizabeth, gosh, you look so great. And I had said, you know, dad, the apple doesn't fall far from the tree. So if I look good, you look good. You know, I don't know what you're talking about. And that's when he knew like, oh, like she's back. This is great, you know, and they say that it takes a village to raise a child. And I think in this day and age, it takes a village to help someone through their healthcare. And I think this is a case in point where I needed my dad, you know, outside of myself to recognize what was going on, how I was doing, and he knew who my true self was. The doctors would come up to him during my hospitalization and say, your daughter just jumped over the nurse's desk to grab the microphone and call her own group session. So she got sedated, and then in my dad's head, he's like, "Oh, this sounds great! Like her humor's coming back." But of course, he had to stay silent. He's like, "Oh gosh, yeah, I'm so sorry. I don't know what happened." And then another instance, my dad got told a story like, "Your daughter took underwear from, you know, where the community pile that people can grab fresh clothes and underwear. She wrote thank you on the butt cheeks because when I would get sedated, I'd have to get sedated in the buttocks, right? So when they came and they had to restrain me and I got sedated, I had thank you written on my butt. And I just pointed and my dad's like laughing inside, right? Exactly. And it's just like one of those things that like to doctors, to staff, like this is so erratic, this is so abnormal and non-compliant, but you need that person in your corner to recognize this is who that person is. And even I lost myself in that whole thing. And I've dealt with this misdiagnosis. It still played, you know, later into my life when I got pregnant. That was a whole mess. But I've definitely been a victim of Murphy's Law in healthcare, and it's been tough, but I truly do think so. Now, what it comes down to is my dad was diagnosed a year ago with stage 3 colon cancer. So now I desperately want to help him through that. There has been things that have happened where they wanted to wait a month for his CT scan to see if it spread after the diagnosis. And it's like, Dad, no, that's not acceptable. That's not okay. You need this right away.
Wow.
You know, and for my daughters who are 3 and 4, they need a better healthcare. It can't be this way. This isn't how it should be. But I truly think that, you know, we do need a village to help each other, to be okay with sharing our story, to be an active participant in our journey that we're going through, and to ask questions. Like, it's okay to ask questions. I think all 3 of us were raised in a generation where it's respectful to not ask questions, and you don't do that. You don't question authority. You don't question your parents. You don't question your doctors. No one. You just stay silent. And I think that's just not the case anymore. I think we do need to ask the questions, and that doesn't need to be seen as being disrespectful. It needs to be seen as we just want the best for ourselves. We want the best for everybody else. We want to free up the wait line, you know, the month-long scan time, because I asked enough questions that I know I don't need 2 follow-up appointments because of that. So that's my backstory in a nutshell.
Yeah, well, thank you. And of course,
Yeah.
Liz, I was privileged to meet you in person a couple months ago
Yes.
and hear that. And
Yes.
of course, sorry for everything that you've been through as well. But I think each of us inspirational, we kind of had some unfortunate experiences that have led us to move forward and do the
Yeah.
work that we're doing today. And I think we're
Agreed.
all trying to advocate for each other. Doctors need to advocate for other doctors and patients. Patients need to advocate for other patients and for doctors, right?
Right.
And
That's
we're
right.
all just sharing our stories.
Mhm.
So Parul, would you like to talk a little more specifically about the work
Yeah,
you're doing and what you're doing, how it helps doctors and patients?
absolutely. And I actually want to highlight, what Liz just mentioned, because so I definitely takes a village. And losing Manu cancer, I always say cancer still takes a seat at our table, and he bore the scars of cancer that could be seen from surgery, radiation, and I bear the unseen scars of cancer. It doesn't, like you said, it takes a village to protect, but once you lose a person, it affects everybody, him and around, and it's very hard to watch. And I'm sure you feel this way, Liz, especially with your dad going through treatments, to watch from the sidelines, not able to help.
Mhm.
And Manu went through a lot of the treatment. Like, he was diagnosed initially in 2019, and the cancer returned in April of 2020. Right, that's when COVID hit, and he was in Canada. I was in New York. New York was the epicenter. There were bodies being thrown. I mean, it was crazy times, and we were so unpredictable with the future. So a lot of his treatment, radiation, chemo, was in isolation. He would go, my parents would drop him and nobody was allowed in the treatment centers. And then they would just pick him up. And so a lot of his decision making was in isolation. We weren't allowed. I would tell him, like, let me in, do a Zoom call when you're in the doctor's. I'll be there. I'll help you as much as I can. And he shut us out. There's a lot of mental struggle that goes on, especially if you're young and given a life sentence. So he wrote the series of blogs, which is the book Life Interrupted, Dr. Dua's Survival Guide, that actually got featured, internationally. And he wrote while he was dying, knowing the mistakes he had made. He talked about immortality, about failure, hope, and not losing it through his whole cancer journey. But at the end, he couldn't finish it. He wanted to be published. Time just ran out. And so I published it posthumously, and I wrote the epilogue in it. And in that, I highlighted the mistakes that were made time after time in his treatment that led to his demise, because he was healthy and young, and he could have taken treatment that wasn't allotted to him. Like, his diagnosis was late because he didn't get a biopsy in time. It spread into the lungs. Then he got his first surgery. He wasn't given chemo radiation when he was flapped open. Why wasn't he given that? Even though he was on a borderline, why not push on a healthy, with no comorbidities, no high blood pressure, diabetes, like, give him radiation, he'll fight it. And the
Mhm.
cancer returned because cancer cells weren't adequately removed. And then they found a chest CT. They found a lesion on his lung, on the same side. He had an initial lesion of the tongue. He had neck lymph nodes removed because there was cancer in there. In the initial diagnosis, second surgery in March, in April of 2020, when he went back in for more neck dissection, they found a lesion in his chest CT. They never did a PET scan to see any other metastasis. And they said, okay, we see something, it's COVID, it could be he's coughing, it might be a small cold. They pushed it for 6 months, which became 7 months. And at that time, the lesion was grown 4 times the size, and he was coughing. And before, so that was in October. And actually, no, October would be 6 months. So November of 2020. And they said, okay, we'll do a biopsy in December, another month later. Before the biopsy could even happen, he was in the hospital, unable to breathe because he had fluid buildup. The cancer was all over his lung lining. And it was finally, the PET scan was done, and it was in his pelvic bone. So from the initial lesion all the way down to pelvic bone within a year and a half. And it was so rapid and aggressive, and the treatment wasn't aggressive, right? Care wasn't given appropriate time. And I highlight all of these mistakes in that book, and how we watched from the sidelines and we couldn't do anything. I couldn't travel, borders were shut, we need
Yeah.
PCR testing, he's immunocompromised, it's cold. There was just so many trials and tribulations, and we lost him. Couldn't do anything. And so I didn't want his death to be just another statistic, like here's another death by cancer. I wanted this to be a change in movement, in pushing for that earlier diagnosis, asking those right questions, asking for those opinions. Like you said, just don't take the treatment. Oh, you don't need radiation chemo? Okay, fine. Why not? Why can't I get it? Can we just get it? Because I don't want to fight this again. It was already traumatic. His initial surgery was removal of half his tongue and a graft. Yeah, it was a hemiglossectomy. It was a graft from his arm to reconstruct, and then a skin graft from his leg. It was an 8-hour surgery with a huge team of plastic, vascular, oral surgeons, ENTs. Like, it was a massive 8-hour surgery. And after that, you don't give him chemoradiation. I mean, radiate him. Like, why did we not push it? So it's all these little things that were missed along the way. And that's why, the book's called Life Interrupted. And walking into his house after his death was like, everything was the same, sun's shining, his clothes are still there because he went emergency. He went on a Friday. Again, he was trouble breathing and he had a leg swelling, which, we found out later he had a pulmonary embolism. And then Saturday he was moved to hospice. Sunday he died. And I was struggling just to make at that time you needed 3 days to get PCR testing. And I was trying to get it expedited. I got there Monday. And so I walk in and everything was the same. His dishes were still in the sink. He had just had dinner and then went to the hospital, medication, his clothes, his blanket on the couch, his dog, everything was there but him. And so I was like, I can't, depression and anxiety, which, we went through all of that, but I'm like, that's not the only result. It's got to be more than that. And that's why I'm honest about my experience, about the grief, about how cancer is so, and this, Cam, from your own, you're going to see this. It's just the worst of the worst, having to go through it. And the decisions you have to make consciously, letting your family know your wishes, how you want treatment, if you don't have a voice, and just getting this earlier so we don't have to go through this and we don't have to have these conversations, that we can celebrate more birthdays.
Right. Well, and like your brother, I did everything through the pandemic. And so one thing I tried to keep in mind is that doctors, during the pandemic, I think they were also so concerned about keeping themselves safe, keeping their family safe, keeping their, patients safe, and everything was changing on a dime. And since it was dealing with his mouth, people in the throes of COVID having to go in people's mouths, and it's it's just so very, very complicated. And like him, I had to do everything myself. None of my family ever met any of my doctors, even from my surgeries. My husband had to drop me off at the hospital and pick me up. And so I understand. So Liz, if you had anything to speak to what Parul said, and then if you wanted to share a little about your work and how it supports doctors and patients.
Sure. So Dr. Parul, I can completely understand that isolating, unable to help feeling, because when my dad got his diagnosis for stage 3 colon cancer, I had just moved with my little family to North Carolina. It had maybe been a year, and I just thought, this can't be happening. I'm closest to my dad. My family is a little disconnected, not really very supportive. So I just felt so bad. And I didn't know what to do because my girls at the time were younger. They're 3 and 4 now, but when they were little, more like newborn stage, infant stage, it just felt impossible to get out there. So I did actually fly out a couple times to go and help him with his appointments, or at the time it got switched. He had to go get a port inserted. He had 12 inches of his colon removed. I mean, he was in surgery after procedure, after scan, like nonstop for a solid year. And I just thought, I don't know what to do. Like, what what can I do? And so from a distance, I would send him some of his, you could see it, right? As soon as I saw him, he had lost so much weight. His energy was low. So I would send him things like a homemade apple pie. I'd have an apple pie delivered to the house, or I would order him one of his favorite meals is fettuccine Alfredo. I ordered him and surprised him having it delivered to the house. Something else that I did, I had no business doing this because I didn't really have the money to afford it, but I didn't care at the time, right? So I thought, my dad has this awful couch. He's had it for years. Like, he's going to go get surgery. He's going to feel like he needs something so much better and a lot more supportive. So I just decided to do it. I got the couch. I reached out to my siblings and said, hey, if you guys want to be a part of this, you can contribute. You don't have to contribute, whatever you're comfortable with. And so I ended up getting my brothers to actually agree to go to the house and get it set up and remove the old couch. And so it was stuff like that that I was starting to do, that I thought, if I can't be there, at least this is something that I feel like I am doing something and I'm kind of there for him. But physically I would love to be there, but mentally I'm still there helping him.
Right.
So that was very difficult. And again, when he told me after his diagnosis that he didn't have his CAT scan until a month after the fact, I got on his case. I got on my mom's case. I said, why is this happening? Stage 3, this is colon cancer. This is so aggressive. Like, it's a very low survival rate. I don't know what we're doing, twiddling our thumbs. I'm not understanding how this is okay with any of you. Like, why is nobody moving on this? And so it was that conversation with my parents that they're like, yeah, it was insurance that was saying that we had to wait, but I'll give them a call back. And it's just like, you guys can't. This isn't like I have a cold or I have the flu. This is cancer.
Yep.
This isn't to be taken lightly. And I'm missing the point where you guys aren't taking this seriously. So now the work that I do with Peace Advocacy Group is, I think the one thing that is so broken and that is so clear to me in all aspects of healthcare right now is trust. I think trust is broken between patient and provider or physician. I think trust is broken between healthcare executives and physicians. It's everywhere. And so what we do is, let's say a hospital or a clinic comes and says, hey, we have horrible patient experience. We barely have a caseload. Can you come and help us? Oh my gosh, we would love to. We'd be more than happy to do that for you. And it's a matter of, what is the hospital or clinic willing to give us the trust with doing? If it's starting with their patients, let's do that. Let's build that trust back up. Let's show you that we can help you through this and to get back to where you were, to get back to being successful. And then we'll talk about your systems, or then we'll talk about your physicians. It's a slow process, and that's okay with us. But we just want to try to build back that trust that has gotten lost everywhere. And if that's what we can do, and if we can just build a little bit of that trust and grow from there, that's great. We're not going to come into a hospital or clinic and say, hey, listen, we're really good with patient advocacy services. You guys are doing great, but we just want to do that because we know that we're great at it. We don't do that. It's a matter of, they approach us. What are you comfortable with? Let's go with it. We'll work from there. We would love to help you with other areas, but if you want to see this be successful first, that's okay. We're actually support that, because again, we want to rebuild that trust that's been broken.
No, I agree.
Yeah, well, that's great. Well, thank you, Liz. So as we're winding down, Parul, I was wondering if you have any top tips that you'd like to share with your colleagues.
Sure. Paying attention, asking questions, knowing what's going on in your patients' lives. I mean, it's amazing how people want to be just heard. They want to be seen. And I think having gone through this experience has definitely made me more empathetic as to stop and take extra time with my patients, which sometimes, you're running, you're seeing, and you have to do another hygiene check, or the staff needs something, and I'm a mom, my kid will call, there's some emergency at the school. And then it's like putting all those aside and just being present at that moment. That's there. And also, because of what I've gone through, and it's a very unique challenge having to as healthcare providers, we're very giving in the sense we give up our time, we don't take a pee break, we'll eat lunch later, we work long hours, and we have a lot going on in our own lives that we try not to bring to our, our practice. And I'm creating what's called Healing the Healers. Basically, if you're a healthcare provider who's gone through grief of a loved one, lost somebody, and then having to show up to work, taking care of others while you're hurting on the inside, how do you process and not lose yourself? And not, and the feelings of grief, any depression, that anger, that anxiety, to get rid of that and find yourself back again.
That's terrific. And I love that, healing the healers. And also, not only the patients want to feel seen and heard, doctors want to feel seen and heard as well. And that's why I particularly love episodes like this. We have a doctor and a patient on together, right? In these conversations, like, we're doing it, right? We're moving the needle just by sharing our stories and having these conversations. So that's just really important to do. So thank you both. And Liz, do you have any suggestions for patients who wish to support their doctors?
Yeah, just be an active participant. Don't be afraid to speak up. Don't be afraid to ask questions. You're not being non-compliant. If anything, you're just joining the conversation. And I think that can really expedite the process and the healthcare journey for some patients.
I agree. So Parul, how can our listeners get in touch with you?
Sure. So there's my website, which is Parul Dua Makkar. I can send it to you on chat and you have it. Yep.
Sure. Yep.
Or on Instagram, I'm at DUA. Good job. So it's a pun off my maiden name. Dua. Good job.
I love that.
Good. Catchy.
Yeah, I'll give my brother the credit for it. He came up with it.
That's fantastic.
I just carried it on.
Well, thank you. And Liz, how can our listeners get in touch with you?
Most easily, I would say LinkedIn. You could find me at Elizabeth Durnan. Or also peaceadvocacygroup.com is our website that you could check out as well.
Okay. All right. Well, thank you very much. And also thanks again for being my guest today.
Yes. Thank you, Kim. Thank you, Dr. Pearl. It's nice meeting you.
Likewise. And where are you based at? You're still in North Carolina, correct?
North Carolina, yes.
Yeah. Okay. What are these states?
Are you North Carolina? Are you here?
New York.
Okay. Oh, that's right. Okay.
Yeah,
One day.
One day.
So Liz, when you come up to
Never
the
know.
Northeast, you have 2 visitors, right?
That's right. That's right.
Okay. All right. So in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Bye.